Welcome Home, a podcast for veterans, about veterans by veterans, is a project of Willing Warriors and the Warrior Retreat at Bull Run.
Good morning. I'm your host, Larry Ziliox, Director of Culinary Services here at the Warrior Retreat at Bull Run. Today we have a very special guest, Miss Holly Crocker. She's the owner of Balanced Arts Massage here in Haymarket. And in the interest of transparency, right up front, I'm going to tell you, she is my personal massage therapist. And this has made such a huge difference in my life and my wife's life that I wanted to have her come and join us so we could talk about massage therapy and the benefits for veterans out there to give you a better understanding of what it is, how it might help you, where to get the service. So Holly, welcome to the podcast.
Larry, thank you so much for having me here. It's such a pleasure to be here.
So tell our listeners a little bit about your background and what led you to becoming a massage therapist.
Well, first, let me thank you for letting me be here and thank all of our service members. So incredibly grateful to them. And not only to them, but to their wives, their spouses, their children, their families, because when they serve, their families serve as well. And also to all those shadow warriors and those who don't always get the acknowledgement on the intelligence community and frontline firefighters, police officers, Secret Service agents. What led me to massage therapy was honestly modern day living and stressful lives. And my body was wrecked from pushing it and not taking great care of it. And so I'm a mom of 5 active children, and I spent way too much time in my car, at a desk, working on a computer, and not taking care of myself. And I started to develop sciatica down my legs and my lower back, and I went to every doctor there was available, and, the surgeons didn't want to operate on me, so they didn't want anything to do with me, and nobody could figure out what was going on. So I worked between a physical therapist, a personal trainer, and a massage therapist for 3 years to figure out what was going on with me. It turns out that I had an SI joint that was out of alignment, that was throwing off my pelvis, which threw off my back, which impacted the nerves going down the back of my leg. And I was way too young to feel this bad. Like I just, I couldn't drive, I couldn't walk, couldn't keep up with my kids. It was ridiculous. This is crazy. And so when our youngest went away to high school and I no longer had to drive him to school, I decided to go back to school. I have absolutely no background in science. My background is international studies and Spanish. But I loved learning about the body from helping to heal my own. And I decided to go back to massage school, which is a 7-month program. I loved it. I did a great job. I actually could learn. I was shocked that I could learn. I've gone on and I've taken lots of extra classes. And I'll mention now that I do both Western and Eastern massage. And I do Chinese meridian therapy as well, and acupressure.
Mm-hmm.
Not acupuncture,
right?
That's with needles.
Yeah.
But acupressure, which is with your hands, which is super gentle, and I love it. I healed myself through learning how to be a massage therapist. And so the people who I'm helping, I can totally relate with what their problem is.
Yeah.
And I love it. Massage it's amazing. I love it. I love seeing what it can do for people. And it doesn't matter how young or old. Like I've helped small children, I've helped athletes, I've helped the elderly. So I love it.
Yeah. What's your definition of massage therapy? There's massage, you can go and get a massage, which is relaxing and all that. But then massage therapy, is that a course of treatment? Is it a type of therapy? What are our listeners, what should they know about what is massage therapy?
Okay, so let me give you a little background for the listeners. I know you've already heard this, Larry, but so the body is amazing. It consists of over 206 bones and over 600 muscles that work on those bones to make the body move like it's supposed to. And our bodies are built to move. They're built to move without pain. Unfortunately, our modern lifestyles, where we're always sitting or reaching in front of us or sitting at a computer or driving a car or looking down at a cell phone, everything is in front of you. And what ends up happening is muscles only work in one direction. So the muscles on our front of our bodies tend to become very tight and tense and what they call hypertensive. And then the muscles on the back that are compensating for that have become long and stretched and weak and sometimes inhibited. And then you've seen people who have like the rounded shoulders or like the necks that are like way forward, or, massage therapy in my definition, what I do in my practice is I help people rebalance. That's why the name of my practice is Balanced Arch Massage.
Mm-hmm.
It's to rebalance the skeletal system so that you aren't in pain, because that pain is a message from your body that something is not right.
Yeah.
You stub your toe, you have pain. Okay, you hurt your toe, right? But you have shoulder, neck problems is probably because you've been working at your computer so long that everything in your chest is super tight. And the back of your neck is telling you, this really hurts. I can't hang on like this anymore. I like to work with my clients. Every session is based on their needs for that day.
Mm-hmm.
Sometimes I only see a client once. Sometimes I see a client for repeated, visits. And it depends on what their body needs and what they want.
I will say I'm a repeat customer because I'm in really bad shape. I need a lot of work.
You're such a pleasure, Larry. You are so amazing. And I have to say that without disclosing any personal information, it's such a pleasure to work with you and with Charmaine and to see how someone who has had habits for a long time can regain motion or momentum with their muscles. And as a massage therapist, I can tell by massaging you where you're holding tension and what muscles are active and which ones are not active. So there are two nervous systems. The sympathetic nervous system is your fight or flight. I've got this to-do list that has to get done. I've got to go here. I've got to go there. Here's the enemy. I'm running from this enemy. I have to go in this direction. Most of us live in that sympathetic state. But the other nervous system is the parasympathetic nervous system. That's the rest and digest. That's the take the brakes off, relax, breathe, actually let your body recuperate. So then the next day you can take on the stress of what's going on. What isn't relaxation is like getting in front of the TV and watching like a horror movie or something like that, because you are like literally activating this sympathetic nervous system. Taking a walk, breathing, literally like bringing oxygen into your body, moving, like working the back of your body. Sometimes some of your muscles become inhibited.
Okay.
Right? So like, for example, when you sit all the time, your hip flexors become very tight from sitting, and perhaps your glutes actually are inhibited now and they don't work. Even though your body makes the motions that your glutes are supposed to do, your brain recruits other muscles to do that. You can feel that as a massage therapist, that those muscles are super hypertensive and they're actually not working. Physical therapists work with this all the time. But to actually make the body work the right way so that you don't have pain elsewhere, you need to make sure that those muscles are active. There are some people who think that if you have a deep massage and it hurts, like to the point where it hurts, then that's healing. But in my case, I don't believe that that's true. Your pain spasm reflex is when you feel pain, then your body tenses up. So if you get a deep massage, especially for me, I know personally, if I get a deep massage, my body actually feels worse afterwards.
Yeah.
So my philosophy is that I work deep, but I let the muscles and the tissue let me in to get to those tight spots, because you have so many layers of muscles and tissues and fascia under the skin that you have to get to.
Well, let me ask you this. So in Virginia, you're a certified licensed professional. And so every state has licensing when it comes to medical professionals and massage therapists. And so right off the bat, if somebody is looking for a massage therapist, that should be one of the first things they check, is say, okay, is this person certified or licensed? If our listeners wanted to find in their area a good massage therapist, what do they look for in a massage therapist?
First of all, you want to find somebody that you're comfortable with. I'll tell you what, you want to find a massage therapist who will address your needs. Why are you going? If you just want a massage, a relaxation massage, great. If you want a deep tissue, like a therapeutic massage that's going to help you, look at the reviews online, see what their advertising says, and see if they work with you. Some people are looking for sports massages. If you're an athlete, sports massages are great. They're very different than a relaxation massage. They're actually meant to activate your muscles and energize your muscles so that you can go perform better for whatever activity you're doing.
Right.
There are Massage Book and other online platforms where you can research about massage therapists and find a good practitioner that way.
There's no harm in just making an appointment and going and seeing how you like that massage therapist and the type of technique that they use. So in your particular case, you had mentioned you do Western and Eastern type massages. And what I can tell our listeners from my own personal experience is that going to Holly, you get a really in-depth explanation about what she's doing to you and how it's helping you. It's not just, lay down over here and I'll somehow work magic and I guarantee you'll feel better. It's, you get a real understanding of the process and also homework. you get homework to work certain muscles throughout the week until it's time to come again and feel amazing. But yeah, so I think it's important that our listeners, veterans, think about massage therapy as a way to help them adjust their body, especially as you get older. Things get a little out of whack, and you've probably been walking wrong or sitting too long or developing bad habits that affect your posture and your whole body. And I would recommend people go and just see if they can get in alignment again and free their chi, which is my big problem. All my chi was blocked up, and it was ridiculous, really. But I think my chi is free now. Talk a little bit about what are the mechanics of massage. Is it usually half an hour? Is it an hour or 2 hours? I know for myself, it's 2 hours, and I need all of that. But not everybody does. So how does it work? What are the mechanics of an appointment look like?
So let me address something before I answer that question, let me address something else that came up when you mentioned all of that. And that is that our bodies hold tension, emotion, stress, memories, both good and bad, in our bodies. And so, you can tell when you're stressed, you feel it in your neck, right? But when bad things happen, your body also responds. And your nervous system is ever adapting. And so your brain will start to think, that having your shoulders forward is actually straight when it's really not. That's normal. Exactly. Yeah. So your body holds these positions thinking that it's normal. And so our job as massage therapists is actually help to remind your body, no, really, this is what's straight. This is where your body is supposed to be. And it's amazing, what can happen. Like I've worked on as old as 88 years old who've had muscles that have been contracted for a very long time and super hypertensive. And in a massage session, I can, open up their whole chest and they're standing up straighter. And that's one great thing about being in the military is you learn great posture because you're supposed to be standing up straight at attention, right? Yeah. But posture is the number one problem in my book these days, because when you have poor posture, then that does affect all of your muscles, and then that creates pain. A session for me is however long your body needs. If it's a sports massage, then it's 15 minutes prior to an event or 20 minutes post-exercise. I can do as long as a 60-minute sports massage to help activate muscles between events for somebody. But for a relaxation healing massage, for me, 2 hours is best when I'm working with my clients. I can do it in 90 minutes, but I can't get to the whole body in 60 minutes. You're just too rushed if you think about all the body area that you're covering. And that doesn't give you the time to actually go slow and and actually release that tissue like the client needs.
Yeah.
If I'm doing something like essential oil therapy,
Yeah, it's my favorite.
you love it. And that is using essential oils on acupressure points, which helps to free the energy flowing through your body to make you feel better. But
It's the chi.
it's the chi. You free your chi.
Yes.
Acupressure in itself is very powerful.
Yeah.
It's super relaxing, super gentle. I love it. I use it on myself all the time. I highly recommend everybody do self acupressure, honestly.
Mm-hmm.
And I didn't even know anything about it until I became a massage therapist and started learning about it. But to answer your question about the appointments, depends on what your body needs.
Right. And that's all part of the initial evaluation when you meet with a massage therapist and say, these are my problem areas. This is where I really hurt. For me, I didn't even realize it, but my breathing was very bad. My muscles in my chest were not working properly, and you tuned them up real good. And so I breathe a lot easier, which helps with my sleeping, singing in church, actually, all sorts of ways. But yeah, it's so important during that initial consultation and meeting to get it all out on the table and don't hold anything back. Say, okay, my knees hurt, my elbow hurts. I fell out of a helicopter, when I was 23 and I was fine, but turns out when I'm 63, it's not fine. And these are all good reasons to see a massage therapist. Holly's in private practice and it's a referral basis only. She has a lot of clients, but there are plenty of massage therapists around. And in your area, I think it's important to at least try it, at least make an appointment and talk to a massage therapist about how they think they can help you based on your medical needs. And, a good massage therapist too, if they think you need treatment beyond their capabilities, they're going to tell you that. And they're going to say, look, there's nothing I can do to help you with that. That almost seems like you might need surgery, or you should be going to a physical therapist, or that sort of thing. So also too, I think it's a fair question to ask, what are the limitations here for me? Because I think if there's a mismatch in a therapist's capabilities and the client's expectations, it's just not going to be a good fit, and it's not going to be a great episode.
It's called scope of practice.
Yeah.
So as a massage therapist, just like every other medical profession, we have our niche in the healthcare community. And so if it's not within our scope of practice, then we'll refer you out. Most massage therapists know good physical therapists or orthopedists or things along those lines, right? I'll just say this, though. If you have, say, back pain, give me an example. Our natural tendency is to go to the primary care doctor, because that's what Western medicine is all about. You go to your primary doctor. And they'll tell you have muscle pain, but they actually won't touch you. I don't know about you, but my primary care doctor doesn't even listen to my heart most of the time when I go. Like, they just, they listen.
Doctor for that.
They listen to you. I have all the respect in the world for doctors. I really do appreciate them. We couldn't live without them. But they'll often just refer you out for physical therapy, or sometimes to a massage therapist as well. Mm-hmm. And I think there's really a need out there for good massage therapists, because so much of our body is bones and muscles.
Yeah.
And our modern lifestyle is so out of whack with what our bodies are able to do that we get stuck in these limited motions. And then we end up in pain. That when you take a muscle relaxer or, a painkiller or something, it actually doesn't fix the problem. It just masks the symptom.
Yeah.
So what I like to do with my clients is, let's figure out what's causing it so that you don't have to take all those things.
Yeah.
Right. And I know that's worked for me. That's worked for my clients that I've worked on. I'm not telling anybody to not take their medication that's been prescribed for them. But I know for me, I haven't taken an ibuprofen for a headache since I started practicing.
Yeah.
There's acupressure that I can do for that. Or I realize that my posture's off and I adjust that.
Yeah.
So there's it's a very holistic way of healing if someone's interested in finding a more holistic way of taking care of themselves.
And so from a holistic standpoint, is massage therapy a part of holistic, well, I don't know, lifestyle? Or when I hear the word holistic, I think it means a lot of different things to a lot of different people. And it does encompass everything like acupuncture and acupressure and massage therapy and everything. Is it a lifestyle? How do you define holistic?
Natural.
Natural. Okay.
And massage therapy is very natural.
Yeah.
The power of touch is incredibly powerful. Just holding a friend's hand or, someone who's grieving, giving them a hug, right? The power of touch is so powerful. And in our modern world, we're so busy.
Yeah.
I'm not sure we're really touching people like we need to. It's also a phobic world, right? Because nobody wants to be sued for anything or whatever. But the power of touch is amazing because we're creatures that need that.
Yeah.
Even people who say they don't really, they really do. The beautiful thing about massage is when done properly, it can't hurt you.
Yeah.
It can release a lot. It can release the tension in your body, but it can also release emotions.
Mm-hmm.
It can release pain, both physical and emotional pain, relieve pressure, lower your blood pressure, bring on relaxation, improve your sleep, improve your breathing, improve your ability to walk or move or range of motion in your joints.
Without pain.
Yeah. Right. That's the point is like you have everything back in alignment. Acupressure is awesome because it either works or it doesn't.
Mm-hmm.
It's not needles. I don't do needles. I do acupressure, which is just using the pads of your fingers.
Yeah.
It's super gentle, super relaxing, and it can't hurt you.
Yeah.
Like you're just touching your body.
And when coupled with aromatherapy, it's just incredible. It's just it's unbelievable. So
can I talk about that for a second?
Yeah.
So I just found it incredibly powerful when you combine certain essential herbs with certain acupressure points. You can either reduce someone's tension and help them sleep better, eat better, relax, or if someone has no energy, you can bring them energy. You can give them more energy, clearer mind, more focus. You can use it for things like tense menstruation or headaches. It's incredible because there's so many points all over your body and so many different essential oils, the combinations, and you're treating not just the muscles, but you're able to work more of the body, more of the systems. It's really powerful.
Yeah, and what I like about it is that the aroma is wonderful. I mean, it's scents that you don't normally encounter in your day-to-day activities. So you get this smell, this aroma of something that's just so different. I mean, and they all are very wonderful and relaxing. It's not like you're smelling gym socks or anything like that. It's all really nice aromas, very relaxing and soothing. And certainly I think everybody would benefit from it. I know I did. What's the most important thing before we close out today that you want to leave our listeners with when it comes to massage therapy?
Just listen to your body. Pay attention to it. When you're working out, make sure that you're working out equally. Although if you're doing a lot of chest exercises, you really need to be doing 3 times the number of back exercises because everything we do is in the front of our bodies. But just because you're young doesn't mean that all your muscles are active. I was working on a high school cross-country runner and was amazed to figure out her glutes weren't firing, which is pretty impressive if you think about it. And boy, she ran a lot faster once I inactivated her glutes. It was amazing. If you are ready to get back into shape and you want to go to the gym, one of the reasons why you get hurt when you go right back to the gym after not being active is because a bunch of your muscles probably are inhibited and they're not working. So then you're using smaller muscles to do those bigger muscles jobs. And that's when you get injured. So take the time, instead of just jumping right up and doing something hard, take the time to activate those muscles. Make sure your body is moving in the way that it's supposed to and it's using all the right muscles before you jump right into exercising.
Well, that sounds like another reason for our listeners to seek out a massage therapist to say, I plan on going back to the gym. That's going to be my New Year's resolution. So basically, this is the time of year to go see a massage therapist, because I know you're going to make that resolution that, come January, you're going to go to the gym. So now's the time to see that massage therapist and say, what do I need to do to get ready to go to the gym so I don't hurt myself? Because I'd rather front load this massage therapy than go to the gym, hurt myself, and be in pain and have to come back to you to deal with that problem. So I really like that idea because a lot of our veterans are constantly wanting to get back in shape. And I think, too, if you make that commitment to go to a massage therapist before you're going to try to get back in shape, I think that will make you more committed to actually trying to get back in shape and not talking so much about it, actually doing it. So I think that's great advice. So I do want to say to our veteran listeners that in season 1, if you go back to episode 35, this was back in December of 2023, I did an episode with Dr. Jennifer Cho, and she's the deputy director for the VA's whole health program at the DC Medical Center. And they have a whole health program that involves a lot of these holistic approaches, such as massage therapy and acupuncture and just a whole host of alternative therapies that are really unusual for the VA, because usually the VA is just all about medicine and pills and doctors and operations and things like that. So it was very interesting to see that they're looking at and starting to become involved in these type of alternative therapies. So if you're interested and you're near a VA facility, check out if they have the whole health program. But listen to that in season 1, it's episode 35, and you'll get a good bit of information about the VA's whole health program. Holly, thank you so much for coming and spending this time with us. It's just great.
Thank you so much, Larry. I really appreciate you letting me be here. And I just wish all of the listeners out there good luck. And I just mentioned, massage therapy can be an amazing tool in your toolbox to take care of your body and help you uncover why it's hurting and help you release, even if it's just not just physical things, emotional things as well. The power touch is really amazing. Even just a massage from your loved one, a mom to a kid, a husband to wife, whatever, massage therapy, if you think about it, we have a lot of bones and muscles, and they all could benefit, right? Because we're always using our bodies for everything. So thank you for letting me have this opportunity to share massage therapy with everyone.
Yeah. Don't ignore your bones, your muscles, and your chi.
That's right.
Well, for our listeners, we'll have another episode next Monday morning at 5 a.m. If you have any questions or suggestions, you can reach us at podcast@willingwarriors.org. Until then, thanks for listening.
The Welcome Home podcast is brought to you by Willing Warriors, a nonprofit organization serving active duty service members and veterans since 2012. To learn more, please visit our webpage at willingwarriors.org.